The NHS faces many challenges: rising levels of multimorbidity, increasing personal pressures, problems with urgent care, with primary care, mental health. So we work with our various partners to develop solutions to these problems.
Our whole programme is about how do we get the evidence that we know to be really good into practice. It's about applying this knowledge very practically for frontline staff who want to make a difference, for researchers who want to create a new way of looking at health.
We're introducing the concept of emotional mapping in order to understand how care services can be further improved and actually adapted to work for those you're really trying to impact.
The main thing from today was wanting to share what we've been working on and to help others learn how to follow the same principles of project work as we have. Many of us are very, very busy clinicians, and for the past year, the fellows, we've made time to do research. And I think more people need to be aware, because research is really important, but clinicians don't always have the time. So it's about making the time for this.
We've been discussing the issue that young people face navigating the healthcare system. There was a lot of uncertainty once I reached the age of 16, as in different areas of the healthcare system, I was no longer seen to be a child, but I was also not considered to be an adult yet.
My talk was designed to encourage people to understand lessons from the pandemic, but equally understand the difficulties of digital transformation in healthcare systems.
I wanted to come along to see what our colleagues in North West London are up to. What I've been really struck by was the initial keynote conversation about digital health, and then the conversation about the community health and wellbeing workers in Westminster, where they brought in the model based on one from Brazil, and I thought was super interesting, super exciting.
The difference that a collaborative approach makes is really having those multiple perspectives in the room, understanding not only the scientific evidence or expertise, but also understanding the systems and how they work for clinicians or managers.
If you are a clinician, coming here helps you network with other people who may give you ideas or give you a solution that you can then put into place in your work area.
The collaborative learning event is one of the most fundamental things that drives good healthcare. You get to meet different people from different stakeholderships, in particular end users and patients, mixing with clinicians and academics. This is the most valuable learning time for anyone who's trying to build a system.
It's not me just telling my story. There's a lot of young people who have the same thing. So it's like I'm being the voice to a number of other young people. So it's something that doesn't matter how nervous I am, it needs to be done.